I'm a little scared.
We got scared.
Oh, that's really creepy. Wow. Cheers.
Good.
My name is Mike Wall, and I'm passionate about exploring health. Come on a journey with me across Newfoundland and Labrador as we learn about wellness here at home. Technology can be a good thing and a bad thing. It can help people be more efficient, to communicate, and to see the world. But when it comes to our health, it can keep us glued to our phones and our computers and playing video games, in a lot of ways more disconnected than ever. Now, I've heard a lot about the tech boom here in Newfoundland and Labrador, and wanted to see whether some of this technology is being used to actually improve our health. Man, oh man, this is weird.
There's no way we look normal right now.
Holy cow, man. That is a far cry from the Atari when we were a kid,
Yeah,
right?
right? Things have changed.
Technology has gone so rapidly, it's insane. How are you involved in all this?
So I've been involved with technology for, over 20 years. And right now as chair of TechNL, I'm seeing lots of what's happening here in our local tech ecosystem here in Newfoundland and Labrador. There's lots of interesting stuff happening in healthcare and medtech health.
Yeah, when I think about it too, you think about like connected. I don't necessarily hear good things sometimes. Like people are on their phone too much, there's too much screen time. It's not good and healthy for us. We're not getting out and being active as much. But can health tech actually like change that and improve our health?
Yeah, if you think about it, I mean, technology, there's good and bad. There's good and bad with everything. But, my uncle just came to visit and his doctor prescribed him a watch as part of his healthcare management. And the more you think about how technology can help people, through wearables, through devices, through our phones, there's lots of ways that we can interact with our healthcare through digitization, through technology.
And also through careers. I mean, you've sort of had this stranger hybrid career. You're a tech guy, but you're involved in health as well?
Yeah, there's so many different facets of healthcare now that are interacting with the tech sector, and like Bounce Labs. Bounce started a few years ago as a part of TechNL, but as a part of the wider health tech and med tech community here in Newfoundland and Labrador. They started, and now they have 45 companies, like member companies, and within a few years. And these are companies that are dedicated solely of like introducing new technologies into healthcare. So
if you think about that many companies and a sector sort of developing, that has to be good for our economy and jobs.
Yeah, I mean, just with those companies alone, but if you look at how much technology has changed, I mean, there's room for lots of different people in the tech sector, right? And people think a lot about programmers, and yeah, we definitely need programmers, but you need all the people who do the marketing, the sales, there's a tremendous amount of opportunity within the tech sector, in particular with technology and healthcare.
Yeah, and I guess the people that understand health as well have to play a role in that as well.
Well, yeah, actually, that's a huge part of it. Technology has a massive role to play in healthcare, and always will. And as the technology gets both bigger and smaller, we're going to see a lot more companies spinning out of health. And for me personally, I can't wait for being more involved in the health tech sector and how we can help physicians make better decisions and help people manage their health better through technology.
Dan, it sounds like there's a lot going on. How do you feel about being involved in the sector right now?
Man, I'm so excited. There's so many things happening. Every time you turn your head, there's either another company or a new technology that's being introduced. It's a really exciting time to be involved in it. And honestly, you get out of bed in the morning and there's a lot to look forward to each day. And it's continuously evolving.
But before I dig into health tech, we've got these passes for the next couple hours. Let's go use them and max them out as best we can.
Yeah, let's go have some fun.
Right, talking to Dan, I realized that health tech's becoming a really important part of our province. I was really surprised to find out that one of the largest and most established tech companies is actually a health tech company. FoneMed runs the 811 service that we've all used to get medical care. So I reached out to their CEO, Charlene Brophy, to learn more. Charlene, tell me about the FoneMed technology.
So we are a virtual healthcare company. So under that umbrella of virtual healthcare, we provide services to patients, providers, clients, and so on, to provide remote healthcare advice and monitoring services over the phone, basically. We've been doing this for about 25 years. We've got nurses licensed in every state throughout the United States. We've got about 2,300 clients there. In addition to that, of course, we're most well known locally because we run the 811 Provincial Healthline Service and have been doing so now since 2009.
You guys are working internationally. how many people do you deal with on an international level?
So we've got about 40 million individuals who can access our healthcare services today.
That's amazing. I didn't know how large you guys were. How does the technology actually work if I'm going to, say, use the app?
Right. So basically all you do, you would download the app and just click on, the nurse line services, and then you can chat with the nurse online, you can phone her, have a telephone conversation, you can video conference in a nurse and so on. And then the nurse will basically assess the symptoms that are presented and then determine the outcome of care. And then in Newfoundland, we've got close on 20 nurse practitioners as well that we can escalate calls from the nurse to the nurse practitioner for diagnosis, prescriptions if need be, and so on.
Wow, I don't think there's anybody that hasn't used the 811 line
No,
over the
I
last
don't
couple of
think
years
either.
at Newfoundland.
Yeah, I think you're right.
And you guys, besides just doing the work here,
Yeah.
you said you work globally. Have there been any times, like things that have really stood out to you as being like pivotal moments in your business?
Oh my gosh, Mike, there's been so many pivotal moments for us. I go back to many years ago when the 9/11 attacks happened. Beth Israel Medical Center was one of our clients at that time. So we were providing nurse advice services after hours for that client. So when the second plane hit, I remembered like yesterday, one of our staff came out and said, turn on the TV quickly, something is happening in New York City. So we turned on the TV just as the second plane hit. And within 30 minutes, our phone rang, and it was Beth Israel saying, we're sending all of our calls to you. Send nobody to the emergency room unless it's life or limb, basically. So within seconds, the phone started to ring. But it was the most frightening experience because not only were there symptom calls, we had calls from firefighters' wives who said, I can't reach my husband, but for some reason I can get through to this number. And the calls weren't going to one another in the U.S., but they could come to Canada. So the calls we were receiving were just terrifying. That 24-hour period was just life-altering, I think, for all of us. So that's one that I will never forget for the rest of my career.
Yeah.
And then as the pandemic unfolded, 2 years ago, I could not have even imagined, what the volume of calls coming to our services would look like. So all of a sudden, we more than quadrupled our call volume. For example, in Newfoundland, we went from 200 calls a day to 2,000 calls a day.
Yeah.
And people were scared. We were all scared because nobody knew what was happening. Nobody knew the seriousness of the situation and so on. So, that time as well is one of the more proudest moments that I've had, mostly of our team.
Okay, so we have 9/11, we have the pandemic, we have 40 million people around the world, more than all of Canada, and you guys are actually helping people with the things you do. How does that make you and the team here feel?
Well, by background, I'm a registered nurse. So helping people is what I love to do and I've always loved to do. So to be able to take that and some of the lessons learned here in Newfoundland at the bedside and take it not only throughout the country, but internationally as well. And to bring around, supporting me, a team like no other that has made the magic happen. I'm proud, and they're certainly proud to be able to make a difference in the lives of so many people right throughout the world, really.
I never knew how big FoneMed was and how many people they're helping around the world. But next, I wanted to experience health tech myself. Now, my research is in nutrition, so when I heard about a new company called Nucliq Biologics that was measuring gut microbiome, I needed to know more. The two founders of Nucliq Biologics, Niki and Purvi, sent me over a test so I could try their technology myself. I mailed it back, and a few weeks later the results were in. They told me to meet them at their lab at the Ocean Sciences Center, but I'm a little nervous about what they found out. This is the home of your business down here at the Ocean Sciences Center. So tell me, Niki, about Nucliq Biologics and why you guys started it.
So yeah, Nucliq is a microbiome-based biotech company. We tended towards it because we are scientists. Our background, Purvi is a medical microbiologist and I'm a cancer biologist. We came up with this idea and started working on it, but eventually we learned that how microbiome can improve your health, and that can be applied later also as a therapeutics.
I've heard about microbiome, but I honestly don't know that much about it. What is microbiome?
Microbiome is nothing but microorganisms like bacteria, viruses, fungi, archaea living together as ecosystem in an environment. For example, if the microbes are living in your gut, they are called gut microbiome.
They're like symbiotic with us, I guess, in a lot of ways, right?
A lot of ways.
So to add a fun fact, like you are more bacterial than human. You're only 10% human and 90% bacteria.
That sounds really crazy. So you tested my microbiome, so I'm a little bit, little scared.
Let's jump into your results.
I can't wait to see these.
So I'll just talk about the positive ones first, and then I'll talk about the little scary ones.
Okay.
But overall, it's excellent.
Okay.
So diversity is a key for any gut bacteria when you're looking into the gut microbiome. So more the diversity, higher the diversity, it's better.
Okay.
So your diversity is looking excellent. So I have a few questions to ask you. Are you intolerant to dairy?
It doesn't work with me. I get like all phlegmy and sometimes I get really tired. It doesn't work good. No, I don't like it. I actually cut it out recently.
That's good.
Yeah.
That's good. That's good. But you can improvise that though by adding certain changes to your diet.
Yeah.
You can improve that dairy metabolism. And talking about certain beneficial bacteria, I know that you had some antibiotic usage in 3 years, right?
Yeah.
So that might be one of the main reasons why, because there are only certain bacteria which were missing.
Huh.
And I can clearly see them.
Yeah, I took antibiotics recently, right before our test actually.
You see, you're just talking about the
Yeah.
it's completely off.
Huh.
And that might be because of your antibiotic.
Huh. That's amazing. It's,
Yeah.
it's like a crystal
And
ball.
you're so happy. That's what gut microbiome says.
I can believe that. I'm happy. Why is that? Why would I be? How can you tell I'm happy from my
that's
stomach?
what we're doing here is we are also analyzing certain bacteria and their abundance which are involved in certain hormone productions like happy hormone, serotonin.
Huh.
Many people doesn't know this. More than 90% of the serotonin is produced in your gut,
No way.
and that too from bacteria.
Yeah.
And you're dealing excellent with that one, and you are good at dealing your stress levels.
Yeah, well, good. At least my stomach is.
And in addition to that, at the end of the report, we're also providing the personalized recommendations about food. Because based upon your unique microbiome report, it says don't eat figs for you.
I love figs. I swear to
It's,
God,
your gut microbiome is not
Really?
helping that.
That's so funny because I would go hiking, I bring figs and dates. And like if I was going to have any cookie in the world, it would be like a fig Newton. I love them. What is that about human beings liking the things that are the worst for them?
Yeah, you have
Yeah.
many other options like blueberries.
Okay,
blackberries.
I like those too. Okay, good. Well, that's good to know.
Yeah,
That's the goal. I always tell everybody there's always room for improvement with our health. So that's great.
exactly.
Well, I guess that's the point of this. So that's my results. But you guys are going to be helping out lots of people in our province. How does this sort of give us insight into the health of our entire population?
So here in Newfoundland, we have a lot of diabetes and obesity, which can be avoided if we get tested earlier in age and see how we can improve our food and lifestyle, which can enhance our microbiome and which in turn can help us. So in that way, yes. And also as this test can be added to the preventive healthcare, which also reduces the burden on the healthcare system. So yeah, that's where we are working towards.
So I'm starting to see that health tech can teach us stuff we could never know ourselves. I used to give people nutrition plans and eating programs, but I could never measure the critters in their stomach and tell them what foods were good for them and which foods weren't. Advances like this can change everything in wellness. Now I still have one company left to visit. They're a 3D printing company called PolyUnity. Now I'm not sure how printing out plastic models can help our medical system, but there's only one way to find out. So Jacqueline, what is PolyUnity?
We are a medtech startup. We're trying to bring 3D printing into healthcare.
Okay, so I think 3D printing, I'm wondering like how does the technology actually work?
We do product design, we do digital inventory, and we do manufacturing. So we work with healthcare providers, frontline workers. They tell us about their problems or they have ideas, and then we design them. And it's rapid prototyping. So within the next day, usually within hours, we have a prototype in their hands. They get to test it and use it in field. And then within a couple of weeks, a bunch of iterations, they have the product in use in their hospital.
So if some of these things already exist, then why can't people just go buy them? And is it important for our healthcare system here in the province to have this sort of ability to print these things?
I think it's absolutely critical, and it couldn't come at a better time. I think the pandemic really put the need for our company in the minds of healthcare administrators. Early in the pandemic, supply chain was inconsistent, unreliable, and the costs were quite high often, with lots and lots of margins built in for resellers and distributors and whatnot. So we're building a digital library right now. So we've got over 140 ideas that we've just collected in the last 6 to 9 months. Play this out a couple years, I think we'll have thousands and thousands of ideas. But you can print this stuff on demand when you need it. So there's no more warehousing. There's no more inventory control. There's no more risk of if you run out of something where you have to cancel procedures or delay delivering healthcare.
So it sounds like you guys have answered a lot of the questions and challenges we've had here in the province around healthcare. What's next for you guys?
So this is a product we make for the cancer care clinic. So traditionally, when you had to get radiation therapy on, so you had a tumor in your nose, for example, you'd have to get multiple appointments, several hours. You'd have to get plaster bandages put on your face, very uncomfortable. You can imagine it's a bit traumatic if you were an older patient, maybe dealing with dementia or whatnot. Mm-hmm. So right now we can either take a scan ourselves with some of our equipment or use a CT scan that already exists and print a bolus. We do this same day.
So you're saying you can actually scan somebody's face and then you can print out a realistic plastic version of it?
Mm-hmm. Why don't we go meet the design team and we can scan your face. You can see how it's done.
Really?
Yeah.
That'd be awesome. I'd love to see that.
Great, let's do it.
The tech boom in our province is bringing employment and careers. So I wanted to hear from people that are working in industry firsthand what the opportunities are, especially for young people. But first, I had to experience this technology face to face.
My name is Rachel Tobin. I'm a product designer at PolyUnity, and I'm gonna scan your face.
Sure, let's try it.
Okay, so I'll put this up to your face. Just close your eyes. It's a little bit creepy if you don't. So I'm gonna hit play and get you to slowly turn your head left and right. I'm gonna stop it there.
Okay, got
All
my
right.
eyes.
Yeah, open your eyes. Let's see what we got here.
Oh, that's really creepy. Wow.
So now we just process it a little bit and hopefully you'll look more like a person.
Wow. So how does it feel for you, being in this world and being young and an engineer to be involved in something like this?
It's definitely not what I expected to graduate in, an up-and-coming med tech company in St. John's, Newfoundland, but it's everything I hope to graduate into, I'll say that much for sure. Especially seeing 3D printing change day by day, week by week. I think there's a huge future for both 3D printing and med tech here with the ecosystem we've got in St. John's and Newfoundland.
It's a bit strange to see my face printed in plastic, and it's mind-blowing to think of all the possible uses of this technology. We have an amazing ecosystem for health tech here in the province, but where does it all begin? Well, Dr. Chandra Kavanagh runs Bounce Health Innovation, which supports a lot of these health tech companies. They're having an event that showcased a lot of these organizations, and she invited me to attend. So I got us 2 popcorns, and we grabbed a front row seat.
Hey, Chandra, how are you?
Good, how are you? Thank you.
Good. I got some popcorn for the big show.
Oh, nice. I'm excited.
We got a big night, so tell me what's up.
Yeah, so Bounce Health Innovation has been working with our partner companies. So we have all sorts of different companies that we work with, all in the health and medical technology field. Mm-hmm. And so we worked with a local company to film a whole bunch of videos with them that essentially are going to look like commercials for their amazing products. So we're going to watch all 17 of these videos in a row.
That's pretty exciting. I mean, I learned a lot about health tech in the province over the last couple of days. And basically, like, you guys play a role as what, like an incubator?
An incubator is one way to think of it. A resource center would be another way to think of it. So essentially, you're a person with an idea, and it's a great idea. It's in healthcare, it's in med tech, and you don't know what to do next. Well, you come to us, and we provide all sorts of different resources. So that's everything from providing you with financial support, like through our embryo grants program, or providing you with support like this, creating a video for you, or helping you meet the right people, get the right collaborators in place. We help you with regulatory compliance, which can be really challenging in healthcare. So we have everything you need to take an idea and turn it into a reality.
Wow, that's a lot. And how many companies you guys currently work with?
We currently work with 55 partner companies. So we couldn't believe it. When we started just 2 years ago, we had 0 companies. We've spent no money on advertising, and we've managed to attract 55 companies so far. And we get a new company, maybe a couple of new companies every month. So it just goes to show that the medtech sector in Newfoundland and Labrador was booming. It was booming before we showed up, and we just helped kind of bring everybody together.
And the thing I'm starting to realize is that it's a massive part of our economy. Like, how big is this for our province?
It's huge. Just with bounce companies alone, we've brought, over the past 2 years, we've brought millions of dollars of investment and dozens of jobs to Newfoundland and Labrador. And this is really just the start for the effect that it could have on the economy. And one of the things that we know about healthcare is that the more wealthy and the more well taken care of your population, the healthier you tend to be. So bringing jobs and bringing economic influence to the province is something that can help with people's health as well.
Well, that's right. So some of the projects are actually going to help improve the wellness of the people in the province?
Oh, absolutely. It's going to help them so much.
Yeah, that's right. And you're helping these companies get this critical first start that allows them to grow going forward and then expand to who knows how big, hey?
Absolutely. And one of the things I often think of is if we're supporting innovative companies here in Newfoundland and Labrador, then Newfoundlanders and Labradorians get that treatment first. They get that innovative care first. And so that means that we're the head of the queue when it comes to these huge, amazing, innovative ideas.
So I guess the question I got now is if I have the next big tech idea and I'm going to change the world and change health with it, how do I approach you guys about making it a reality?
So one of the things you can do is you can reach out to us at bouncehealthinnovation.ca, and from there we'll have a consultation with you and we'll help figure out what your next steps are. That could be everything from a clinical trial to test your technology, to talking to CEOs, computer scientists, engineers. Maybe you need a little bit of money. Often you do in order to be able to get these things off the ground, and we can help with all of those aspects of starting your business.
That's exciting. I can't wait to check out all the different stories here tonight. They're going to
really
start here soon. We got a popcorn. Good?
Yeah, absolutely. So we're going to see a whole bunch of Bounce innovators on the screen, and we're pretty proud of them.
Right on. Well, cheers.
Good.